Hi, this is Dr. Donald Pelto. I want to go over some of the common questions that people have with nail fungus. Here's some pictures of some real thick toenails, some toenails with just some white discoloration at the top, and here's a couple of before and after pictures with people with laser treatment for nail fungus. So we're going to go over today a little bit about, for example, what causes nail fungus, what are the treatment options, what medications are there, will the Lamisil hurt your liver, and then will it come back? Okay, so once again, normal nail, discolored nail, and this is kind of a very bad one. This is the progression of it getting better in different severity levels of it. So what causes nail fungus? It's usually caused by an organism called T. rubrum. If you're unsure if you have a nail fungus, the best way is just to trim a little section of the nail, put it in a cup, and you'll get a pathology report back in about 2 to 3 weeks. Here's an example for a patient, John Doe, showing onychomycosis here. And when we get this result back, then we can decide how we're going to treat it. Okay, there are a couple of different types of treatments. One of the more common ones that people try before they come and see me is nail polish. There's a topical nail lacquer that you can use. It's a good way to start until the sample is back, and it's better if you're older, if you want to prevent recurrence. The nice thing about a Formula 3, which we have in the office, is there's a guarantee with it. So if it doesn't work, you can get your money back. It typically costs about $40 through the office. About 20% effective, in my opinion. Some patients are more. That white nail just on the top works better for something like that than a totally involved nail. Other treatments that there are, this is kind of a busy slide, sorry about that, but oral medication is about 80% effective. You take 1 tablet a day for 3 months. The one that we use most commonly is called terbinafine. It's very safe. We have to do a liver test before, or a nail, some blood sample to determine everything's okay. So usually what happens is I take a nail sample the first day, I go over the nail sample results, and then I get the liver tests. And if it's okay, we send the medication to the pharmacy and you begin. If it's bad, if your blood test is incompatible for having that treatment, then we consider other options like laser therapy or the topical. At about 8 weeks, we may get a repeat blood test if we need to, and then about 6 to 9 months for a new nail to start. This is very effective. I still use this a lot, but one of the more high-tech treatments is called the laser treatment. This is very effective, about 80% the same. Maybe a little uncomfortable when you're doing the treatments, but the main thing is you don't have to take a pill. What we do is we do a nail sample. I'll go back and review it if everything's normal, and then we'll do the laser treatment. Usually it's a treatment day 1, okay, 1 month later, and then 4 months later. Okay, this is the 3rd laser treatment, and then we want to look and evaluate if there's any recurrence. A few things about laser treatment: we have to get the temperature to the yellow light, which is 102 to 107 degrees. So here's the yellow light on our little temperature gauge. We use this little spots, and we kind of go back and forth on the nail, and you put about 100 pulses in the little toes, 400 to 600 in the big toe. So we want to do a total of about 1,000 pulses. And then to prevent it from coming back, we use some type of a shoe sterilizer. I like this for the odor, Mycomist, and then prevent it from coming back in the shoes, I like the Steri shoe. One thing that's very interesting is when we're treating this, we would like to treat the whole foot, and we have to determine, well, are there any problems? Do you have any sweating? If you do, you may want to do Formidon or Bromi lotion. Those help reduce sweating. Do you have any odor? You may want to do Mycomist. And then if you have any athlete's foot, you may need to do a cream for that as well. So this is just a little review about nail fungus and how you can treat it with some of the more common types of treatments. If you want to learn more, you can go to drpelto.com, put your email in the little email box, and I'll send you a big list of information about nail fungus, about different types of foot conditions that you may have.